Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and I wanted to go over just a quick mental checklist that I have to know when I'm done with phase one cases, phase one interceptive cases. This is different from that uh, DEBOND checklist that I have for aligners and for braces for comprehensive or phase two cases. Completely different when all the teeth are in. This is just phase one. We're not doing everything. And a lot of times y'all either underbake your phase one or you overdo your phase one. They're either burnt or they're raw. You didn't quite knock it out of the park. And these can become litigation if you don't do a phase one properly, especially if and when you thought you did it, like you said, oh, the parents said they were fine, the kid was fine, but then later maybe they go for like a phase two evaluation, at an orthodontist or another dentist, and they're like, what, you had phase one, what? I see this all the time, and people are going to come back to you. It may not turn into a lawsuit, but it might turn into a complaint, a board review complaint, a regulatory complaint, or they're going to ask for a refund if you didn't do all the stuff. Because unless you hit all the stuff, somebody's going to say something. Although now parents and patients are getting way more educated as to what phase one includes, and they will call you on it, and that is embarrassing. If you miss something and someone else catches it, you're going to have some explaining to do to the patient and parents. Now, sometimes we don't do everything in phase one, but we discuss it with the parents and we agree as to why we did it. Now, I don't have an issue with that, especially if the patient is going to be seeing me for phase two. But don't assume they're going to be seeing you for phase two, and don't assume this isn't going to become a problem. So if you didn't finish something and it's because of a reason that you guys mutually discussed, then you better write that out and get a signature on that. Otherwise, it's going to come back to bite you later. Okay, so let's go through that checklist. It's a little small. I'm actually going to redo this. If you're watching this later, there might be a brand new, um, you know, cover photo on this where it's a little bigger because it's a little small. But basically, remember, the goal of phase one is to fix the bite, fix any habits, fix myo issues, and to set everything up so that everything just comes down. Now, can we guarantee as they grow everything's just going to come down? No, there's no guarantees. We can do what we can do. We can build the foundation, the scaffolding, get everything ready, get all the troublemakers out of the way, get any habits out of the way. So hopefully, your threes, fours, fives, and sevens will come down properly, but can we guarantee you that they will come down properly? No, but there should be space. You should have done your part. So, your upper and lower 2 to 2, that's your 7, 8, 9, 10, your 23, 24, 25, 26, 2 to 2, okay, should be erupted, aligned, and in proper occlusion. Now, sometimes, that being said, this is a bit of a gray area. Phase one doesn't always include cosmetic alignment. Now, I'm not going to be a jerk. If a patient or a parent wants their lower anteriors straight, like if they're just teeny bit rotated, nah, I'm going to say, the bite is good. We have plenty of space. Do you want me to put braces on this? It's one more thing to clean. Anytime we have something moving, it always can decrease root resorption. If it's just for cosmetic and then we're going to have nothing going on for a few years and then we're going to be doing phase two, I don't personally see the point, especially lower anteriors, but there's going to be, I would say, if you ask the parents, better to have that conversation earlier than later. A lot of times they would prefer not to do it. It's just one more thing they have to clean, one more thing they have to worry about breaking, unless it's for a reason in terms of health or hygiene, occlusion. A lot of times parents will elect to skip that, given that we're not necessarily going to have retainers after phase one, and the retainers they're going to outgrow anyways very quickly, and they will relapse a little bit because that's not the point of phase one. It's not for cosmetics. Now, for some people, the point of phase one is cosmetics, especially people in the entertainment industry, models, stuff like that, and they're going to expect proper retention, and they're going to expect you to have retainers throughout phase one. So this is a conversation you're going to need to have, because sometimes you need to make sure they know they're going to get one retainer if they need it, and then any other retainers they're going to need, they're going to have to pay for, because it's really unnecessary to have retainers after phase one, except for in a few circumstances. And I have a whole nother section on phase one retention. You can find that in my phase one channel or my retainer playlist channel, but we're not going to get into that. So anyways, upper and lower 2 to 2 erupted, improper occlusion, alignment as needed, if and torque. Obviously if one is like jetting out at a weird angle, then that's not proper. There shouldn't be any anterior contacts. This means when they bite down, these teeth shouldn't be touching these teeth. There should be a teeny bit of overjet, right? So that's phase one. So sometimes the C's are still in, sometimes the C's are out when we finish phase one. That doesn't matter to me. But if the C's are in, there should be spaces around the C's for the threes to properly erupt. If there's no spaces around the C's, and if you ever do a phase one interceptive case in Align Technology, in Invisalign first, assuming the text did it properly, you'll see spaces around the C's. They will set it up like that. They will actually look, especially if you put the CBCT in there, but if you send that pano, they will look at it and make sure there's spaces for the threes, upper and lowers, to come down. There's going to be space. Again, can I guarantee they're going to come down? No, can't guarantee that. There's no guarantees. All we can guarantee is that we're making the space for them to come down. So if they come down, they will come down. Okay, so space for the threes. I usually add, it really just depends on the size of that tooth. Again, this helps if you actually put the CBCT in the plan, but you should have space on both sides. There should not be a vaulted palate. Your palate should have remodeled. That should be a part of that. So if myo exercises are going to be part of the plan, it needs to be part of the plan. You need to integrate that into the plan. If you need to do an RPE or an IPE, then you need to do that to remodel the tongue. The mouth, so it's big enough so that the tongue can go up, but that doesn't mean the tongue's gonna go up. If the tongue doesn't go up because it's tethered, you're still gonna have a vaulted palate. Again, that's something you should have caught at the diagnosis. If the patient had a tethered tongue, you're still gonna have your vaulted palate, and the face is still gonna grow down. This is not proper phase one. The myo may need to be part of proper phase one, or you may need to do the myo before you do phase one. A lot of times y'all are rushing into phase one without doing your myo and ENT, and you're getting terrible outcomes. Maybe initially it doesn't look bad, but as they grow with the bad airway or with the bad myo, their faces look terrible. And guess what? There's your liability because you didn't do your diagnosis for phase one. Okay, there shouldn't be any oral habits. Nasal patency. Again, you should have tested that in the myo screening, or if you don't want to deal with that stuff, send a myo, get a release. Send to ENT, get a release. If you don't want to learn how to do this stuff, send to somebody who can. But anytime there's another stop for the patient, another stop for the parent, they might go to someone else and get screened. And this is where you guys are messing up because you're feeling pressured to go ahead and start that ortho without phoning your friends, the myologist and the ENT, or the pediatrician, and getting those releases in writing. I have a lot of content about this. You can learn to screen yourself, but if you find something wrong, you can't start that ortho without that release. Now, if you don't have that release and that case goes sideways, it's on you later. It's on you. It's going to come back to you. Okay, there shouldn't be any cross bites, anterior or posterior. Your upper teeth should be, half a tooth wider, than the lowers, and there shouldn't be any crowding, and there should be space around the threes, right? So if you under expand, then you're not going to have space for the teeth to come in, and they're still going to be impacted or blocked out going into phase two. Guess what? That's going to come back to you. It's better to overexpand and leave extra spaces. Nothing wrong with that for phase one. That is totally fine. Shouldn't be any AOB. There shouldn't be any POB. That means you should be able to see some of the lower teeth, but you shouldn't be able to see all the lower teeth when they bite down, right? Should be some overlap vertically. There should be some overlap in an AP direction. And your back teeth should be touching. If your back teeth aren't touching, you did something wrong. And there shouldn't be a deep bite. We should be able to see some of the lower teeth, but not all of the lower teeth. Somewhere between 10 and 50, 60% showing, somewhere in there. There's some wiggle room, again, in phase one, but you should have at least addressed the vertical, the AP, or sagittal, as well as the transverse movements, and made enough space for all the teeth to have space to come down. Again, can we guarantee that 3s, 4s, and 5s and 7s will come down? Nope, can't guarantee that, but I can make space and give them the best opportunity. So that is when phase one is done. Once that stuff is done, you can consider retention and whether it's going to be beneficial or not. Sometimes it causes more trouble than it's worth. And they're going to grow out of them like crazy. You can do a bonded retainer, but sometimes those can cause troubles too, and you're going to have them on a super recall and deal with all the breakage that's going to happen, which isn't really required as part of phase one treatment. So again, you need to figure out what you're going to include, what you're not going to include, and tell them on the front end. And start having those conversations about retainers, yes, no, and what's going to be included early so that they're not getting upset, because I think retainers and that period of time between phase one and phase two is the time when people get most upset. So I would definitely keep your patients on a tight recall between phase one and phase two, at least every 3 to 6 months, maybe more often. And yeah, you can't charge extra for that. That's all going to be included. So make sure you're charging enough. Some of you guys are way undercharging for your phase one, which is nothing wrong with that. There's a learning. It's really not that hard. It doesn't take a lot of doctor chair time. But remember, you're also going to be keeping an eye on them till they're ready for phase two. You can't charge for those visits. It's just a quick peek. You're not going to do any treatment. If you're a primary care dental practice, that's great because they're coming in to get treatment with you and getting recalls anyway, so it keeps them in your office. It's going to be included as long as they stay part of your thing. If they decide to move and go someplace else, so be it. You can't. They're officially done. You're just doing this as a courtesy between now and when phase two starts. And the problem is if you don't have that kind of process or operating procedure, a lot of times you're going to lose the patient, for phase two, which is like the easiest part. So I strongly recommend this. So hopefully this was helpful for you. All right, thank you.